The finger splint can be used for finger fractures and lacerations as well as for tendon repairs. To begin, measure from the wrist joint to the tip of the injured finger. Cut the desired length of the splint. Hold the splint up to the patient's hand and measure the length of the injured finger. Mark the spot with a pinch at the web space. Next, cut the splint from the end of the wrist towards the marked spot. You can open the padding and trim the edges round at the end facing the wrist later. Fold the substrate lengthwise and cut out a 1 finger wide strip of the substrate up to the pinch. For a smoother edge, you can trim the edges round at the V-strip of the substrate. Put the substrate back inside the padding and close the padding. Cut up center, leaving a margin of padding on either side for skin protection purposes. You can trim the padding to match the round edges of the splint if desired. Activate splint with water. Slide the V-strip next to the injured finger with 1 strip at each side of the hand. Put a padding stripe between the fingers to prevent skin irritation. After this, fold the entire splint in one direction, capturing the injured finger. Wrap with a bandage to secure the splint. Anchor at the injured finger, wrap around the fingers twice, and go down through the web space of the index finger and thumb. Wrap around the wrist to secure the hand. Continue through the web space of the index finger and thumb again, and move upwards to the injured finger once more. Fixate bandage at the patient's wrist with tape or a hook and loop fastener. Position until the splint is in a rigid position. Mold as prescribed by the physician. When the splint is rigid, do not forget to cut the overlapping padding at the injured finger to check circulation.